Hi, this is Toby with the Paramedic Fall Program Cardiology, explaining how the heart works. The heart is basically a blood pump that consists of 4 chambers. The top right chamber is called the atrium. Top left is called the left atrium. And the bottom part of the heart on the right hand side is called the right ventricle, and the left has a left ventricle. So when blood comes in to the heart, comes down through the super vena cava into this right atrium. If I open that up, you can see it kind of just drops down in there. Then there's valves that go between the atrium and the ventricle. On the right side is called the tricuspid valve that lets blood flow into the ventricle, and then the ventricle pushes it up through the pulmonary artery, which goes out to the lungs to get oxygenated. When the blood comes back in from the lungs, it comes back in through the pulmonary vein, which comes into the left side of the heart in the left atrium. And just like the right side of the heart, the left atrium has a valve. It's called the bicuspid valve. And the blood will come into the left atrium, and when the atrium contracts, it pushes blood up through the aorta and out to the rest of your body. So on top of this right atrium, that's where your electrical activity starts. It's called the SA node. That'll fire. It'll send an electrical signal down to the AV node where it pauses, and it continues down to the left ventricle and into the Purkinje fibers, which circle the bottom part of your heart. You can kind of see different fibers that come up, and they contract and they squeeze. That's what pushes the blood out of the ventricles. So the left ventricle, you can see the wall is thicker because the left ventricle has to contract the most and do the most work because it's pushing the blood the farthest. It has to push it all the way out through the aorta out to your body. The heart is connected with the nervous system. There's a sympathetic nervous system and a parasympathetic nervous system. The sympathetic nervous system is your fight or flight, they call it. So it's like an adrenaline rush. Sympathetic releases epi and norepinephrine, which speed up your heart rate. And the parasympathetic nervous system releases acetylcholine, which slows down your heart rate. So if you get scared, it'll release some chemoreceptors, your chemicals, to speed up your heart rate. And if your heart rate gets too high, it'll start releasing acetylcholine to slow it down. So there you have it in short, how the heart works. Thanks.